So for the squat, there's lots of assessments I like to do. Sometimes if you see a client who's not squatting well, especially if you're a newer coach, it's hard to identify what the restriction is. So it's nice to sort of break the squat down, deconstruct it into its different parts, and see how everything looks. So the first one I like to do is sometimes called the quadruped squat test. It's usually a variation of a frog rock or a frog position. So sometimes I'll call it the frog rock test. And this is going to look at your hip mobility, specifically your hip flexion, okay, and what your hips can do in different levels of horizontal adduction or abduction. So I'll show you what I mean. Um, so frog position, quadruped position right here. And what you do is you just have the client bring their bum back to their heels like this. So that's all we're doing right there. And what you're looking at is this angle right here. Now, a few things I'm going to say is, first off, watch out for internal external rotation of the femur. I naturally am biased towards external rotation, and I don't have very good internal rotation. So you'll see my feet are very close together like this. If you look at what my femur is doing, I know this is hard to think about because I'm at a 90-degree angle. Okay, but this is external rotation. You see my knee is twisted outward. This would be internal rotation, which is quite challenging for me. So when you do the movement, I naturally cheat and I go into this big external rotation, which gives me a little bit more room at the hips. But if I'm squatting, I probably am not going to be able to get this position on the ground. It would be really hard for me to do with my feet planted. So I need to be mindful of trying to get into more neutral position without loads of external rotation when I do this movement. If I do this, I can come down here all day, okay? And it's going to make me think that my squat is much deeper than it really is. But if I bring my feet out like that, get to a more neutral rotation, and I come down, I can see actually I'm much more restricted. And all of a sudden, I feel that restriction right here, okay? And this is much more close to what I'm going to feel when I squat. So you get your client, you get them to move their bum back, getting their bum to their heels. And what we're looking for is we're seeing, do they break their neutral spine and go into a sort of butt wink? If they do, then that's probably too deep for their current position. If you stay neutral, okay, you want to see how far can you stay neutral before they shift into that bum wink. And one of the things you can do is you can adjust your squat stance from this position. So you can try a more narrow squat stance here, see how that feels. So I can really feel that I sort of have, if not full impingement, I definitely have limitation coming from the front of my hips in this position. Whereas if I go a little bit wider, it opens up a little bit more space. And what we're looking for is we're looking for this relationship. Can you get the hip crease to get below the knees? And for me, I can tell that I can just about get to parallel before it starts to feel really tight in my hips. So I know that my hips are going to be a limiting factor when I squat. So I really need to pay attention to that. And I also know that I have a tendency to go into butt wink to try to make up for the tight hips. And my spine has a tendency to roll under. So for me, it doesn't look like it, but this is a really challenging movement, even though it doesn't look like I'm doing much. You'll have some clients who can be in really nice position here and get really low and not even understand how it could be difficult. But you'll have some clients who are more like me, who just doing this already, I can see that I need to work on my hip mobility before I go into the squat. Next field assessment I like to do is the kneeling heel sit. This is looking at your knee flexion, range of motion in your knee flexion. Can also sort of tell if maybe you're tight in your knee extensors, your quads, to see if maybe that's causing a restriction. This is another one of those assessments that for a lot of people won't feel like anything, but then for some clients it'll be really challenging. So again, I see that naturally I'm going into this external rotation of my femur right here, where this would be more of a neutral position. So I'm going to be mindful of what I'm doing right here, because this might also be me trying to get around tight knee extensors. So all I do for this one is I just come back and just sit, and I think, I see, can I get my bum to touch my heels? And if I lean back, I can kind of get it, but this is actually a good stretch for me. This is usually a really easy one to fix. You can just have people spend some time back here. If I lean back, it changes the leverage, and I'm feeling a really intense stretch on my quads right now. Again, some of your looser clients might not have this. A lot of your tighter clients will. One of the things you can do, if this is a limiting factor for some people, is you can go ahead and just grab a kettlebell and you can just do weighted heel sits, and I'll just go ahead and do them in real time for you. All right, so at the beginning, I was really having trouble getting my bum to touch my heels, but now I'm just doing a few reps. These are almost a bit like the reverse Nordics, but they have a slightly different goal. And all I'm doing is I'm just spending a little bit of time here trying to get my body comfortable in that position, and it's just stretching out my quads a little bit and just seeing if I do a few of these in a nice relaxed position. Let's see if I can sit back on my heels now. Yeah, it's better. So now I can actually get my bum to touch my heels and it doesn't feel like a super stretch. So this is a really easy one. If you do find people have restrictions right here, this is one of the quickest ones to fix with a bit of stretching. And then if you do it every day, you can kind of get that new range of motion on it. Next, I'm going to talk about the half kneeling dorsiflexion test. You remember that dorsiflexion is the ability to sort of bring your toes back towards your tibia, back towards your shin. But when your foot is planted, you're not going to see dorsiflexion in terms of bringing your foot up. You're actually going to look at it in terms of tracing the angle of your shin relative to your toes. So we're looking at this sort of angle right here. And what that does is it allows you to bring your knee over your toes more, which allows you to stack all your joints in a more, I'm going to say, advantageous position when you're squatting. If this is out of whack here, then it's going to make it harder for me to get my hips below, which is going to make it harder for me to keep my torso vertical, which means I'm going to bend forward more, which means it's going to affect the way I feel my squats. I might feel them more in my lower back than my quads. It also means for cyclical movements, like thrusters, that I'm not going to have that efficient piston movement. So I'm just going to be folding over again and again and again instead of bouncing out of the hole. So all these things can be affected by your ankle dorsiflexion and also your limb lengths and things like that. But anyway, this will be a big limiting factor for a lot of clients. It's one of the things that new coaches don't think about, but it's probably one of the first things that experienced coaches will look for. So we've got our half kneeling dorsiflexion. You know, the key about these field tests is not to be too precious about it. What I'm trying to do is I'm just trying to get a sense of, can I get my knee over my toe? Am I doing anything weird to my foot? Am I working around a restriction? If I were barefoot, could you see my whole foot collapsing inward? Am I bringing my heel off the ground? Lots of people will have little tricks that they sort of unconsciously do to make it look like they have better range of motion. So if I had a stick or something like this, I could just put it in front of my toe. I can just see, can my client touch a stick in front of their toe? If I bring it away, trying to keep it perpendicular to the ground, can I do it a little bit more? Okay, already I can see I'm starting to compensate there. If I go any further, I can see my arch is starting to collapse. I want my heel to raise. So this is about as much as I've got. Now, normally I would say that you want people to have maybe about a fist worth of distance between. So I really have to work on that. And already I can see my foot's collapsing in. I already know I have tight ankles, so that's not a big surprise. The question is, what can you do about it? So there's a few things you can do about it. Just working this motion right here can be a nice way to warm up your ankles. Other thing you can do is if you feel like it's coming from tight calves, you can just ask your client, okay, say, hey, what happens if you push any further? And they might say, oh, it feels really tight here. Maybe you can stretch it out. In my case, I have some sort of anterior impingement here. I can really feel it. So I have to work on it slightly differently. But for some clients, you could just have them maybe get into some sort of modified downward dog position and work on their heel pumps, really trying to push their heels down to the ground, and that might be all it takes to get a little bit more range of motion. But what other things you can do is you can work on some weighted kettlebell work. So if you just put the kettlebell on your knee when you're doing this, and as you come over, just the weight of the kettlebell is just going to help push you forward a little bit more. And I can feel, not exactly a stretch, but I can feel a little bit of movement in the front of my ankle that makes me feel like I'm getting a little bit more range of motion. The last one that I quite like, that's becoming a popular movement, is the front foot elevated split squats. There's loads of ways to do it. Normally you do them with a bilateral weight, but I'm just coming up here. Again, you could use a small box, a jerk block, a concrete block. I just had a tire. It's a stable tire. so I know I can put some weight on it. So from here, I'm just working. I'm bringing my knee forward over my toe, trying to keep my back leg straight and coming back out. This is a nice movement, and it's also good for building mobility. You can do the same thing. You can put the kettlebell over the knee and just try to push your knee forward, keeping your chest up high, just like that. And if I do a few sets of those before I squat, that really helps my squat depth. Last thing, it's not really technically a field assessment, but it's a way that you can teach people to squat a little bit deeper by loading a cue, which is to pull yourself down low. So I call this active pull to a squat. This is one of the first movements that we do when we do our classic squat complex warm-up. Some people will call these Russian baby makers as well. You might see them called that on the internet. So I'm getting in my more or less my squat stance. I'm gonna push my bum back, get a little bit of tension in my hamstring, so sort of a bent knee hinge, and I'm gonna grab my toes like this. And this is where the actively pulling yourself down comes in. You grab your toes and you really actively pull your bum down as low as you can. And because I'm pulling onto my toes, I'm not gonna fall backwards. And what I'm actively doing is I'm really working hard to pull myself down. In my case, the resistance isn't coming from any sort of weight. You'll have a lot of people, if they're sort of tightly built, where they can squat better as the weight gets heavier. They need a little bit of extra weight to get them down. This is a way to teach you to actively use some of those muscles to pull yourself down. So I'll do a few more. So from here, I'm gonna pull myself down, and I'm just gonna do a few now of these, pulling myself down as low as I can. And it actually feels a bit like a resistance exercise because I'm just working against the tightness of my body. Now, as I'm doing that, I'm trying to fight to keep my chest up high. And what you're doing is you tell the client, I want you to think about the actively pulling yourself down when you do the movement. And then you have them do a few squats. And then normally maybe they can just come down here. Maybe that's where their body stops. That's about where my body stops. Then you say, now what I want you to do is I want you to think about that pulling sensation and actively pull from your hamstrings, actively pull from your hip flexors, and try to pull yourself down. So I'm not using gravity here. I'm actually using my muscles to pull myself lower. And it's the difference between this, which is me just stopping. This is where the tension of my muscles and my joints just stop. And this is me actively pulling myself down lower, okay? So sometimes if you just teach the client the concept of pulling themselves down lower, you can get a few more degrees of depth on your squats.